People is proud to present the 40 Days 40 FinTechs, an initiative under its Include Everyone program, which is leading the way in advocating for technology that promotes financial inclusivity. Since 2020, we've profiled over 100 FinTechs, and our latest season is shining a spotlight on those breaking down digital barriers and transforming lives for the better. Join us in this financial inclusivity revolution, presented with generous support from the Bill and Melinda Gates Foundation. Follow hashtag 40 Days 40 FinTechs, hashtag Level 1 Project to learn more and get involved in creating a brighter financial future for all.
The 40 Days 40 FinTechs initiative continues to shine a spotlight on innovators that are using fintech to transform lives of millions and millions of people in Uganda and across Africa. On day 9 of 40 Days 40 FinTechs initiative season 5, we are glad to have a team from My Doctor who are going to tell us how they are using fintech to support their healthcare services. We're happy to have you, sir.
Thank you very much, Mr. Nicholas.
Yes, how are you, sir?
I'm doing well. I'm glad and sound.
Could you please introduce yourself, what you do, and My Doctor generally?
Yeah, I'm called Dr. David Mwesigwa, and I'm the medical in charge of My Doctor Digital Healthcare Services. My Doctor is a healthcare service provider that is dealing in what we call traditional healthcare. However, we are venturing in what we call telemedicine or digital health services. Someone might ask, what are the traditional healthcare? Traditional healthcare is the healthcare routine that all of us are used to. I get up, walk into the hospital, I see the doctor, I'm worked on, and then I go back home. However, telemedicine is when I can access the doctor from the convenience of either my office or my home or from wherever I am. We came up with this innovation because we realized that very many people were having health concerns that just need to talk to a doctor even if they have not moved to the hospital directly. Also, there are a number of people who are tired of the long queues in the hospitals, so we decided to connect them to the doctors easily or to healthcare service providers easily from wherever they are.
Yes, sir. So, Dr. David, we are going to go slowly because, the layman might say, on fuga speed,
Okay,
genda mpola mpola. Yes, maybe now that you have talked about traditional healthcare services versus the digital new latest healthcare services, someone might want to ask, why are you introducing the new way of healthcare? Is the traditional healthcare system not working?
The traditional healthcare system is working. However, we are in an era whereby technology is taking over. And as healthcare service providers, we also need to move with technology, and we move where the world is moving. At the same time, we need to look at, can we bring in a new service that is going to help solve some of the problems that people have or people have been experiencing that cannot be well covered or well assessed by the traditional healthcare system. Let me give you an example, Mr. Karunji. You can be at office, you get a challenge, maybe you get a sudden cough and it is persisting. You don't know what to take. That will need you to move, look for a hospital. Maybe there is a hospital that is where you usually go to, and it is over like 5 miles away. You have to endure the jam, go make up the queue to see the doctor, and only to prescribe for you just one type of tablet. So we are saying, can we solve that problem? And yes, technology is there. So you just get your phone call, you make a phone to My Doctor, we connect you to a doctor who is there, and he will assess you, and then they give you an online prescription. At the same time, with My Doctor, we even have mobile pharmacy services. After making for you a prescription, we can even deliver the drugs directly to where you are.
Where is My Doctor located? And related to that, what is the reception like for digital health services for the people in the community you are located?
My Doctor is located all over Uganda because we are a digital healthcare service. However, we have physical premises that are found in Nansana, Mastowa, where we serve people who come into our facility physically, and also it hubs us our center, whereby we have our office for the telemedicine services. We have our laboratory, and all those are located in Nansana.
Yes, so what feedback are you getting from the immediate community in regards to telemedicine?
From the community we are located in, telemedicine has been welcomed warmly, and we have seen it over time that we are having more clients who are embracing the telemedicine services, although previously they were using the traditional healthcare service, even with us as the service providers, because of the convenience it gives them. Secondly, the privacy it gives them, and then also its cost effectiveness. Someone would ask, how is it cost effective? With My Doctor at the moment, our online consultation is free. So someone feels like a doctor has come, I'm talking to a doctor at a free cost. I'm just maybe using my airtime, I'm using my data, which might not amount to the cost of ordinary consultation in a traditional healthcare system.
Let us try to break this down to the young people, the Gen Z people. Let us assume, let us try to use a language best understood by the young people. Let us assume Director George has assured that is an emergency and is located at his home in Natet, and he wants to get services from My Doctor. Take us through that process.
Okay, so let's assume someone wants services at their home and it's in Atete. So we always call in at My Doctor. We ask you, what service would you need? So let's say this person needs maybe HIV testing, or HIV testing kits.
I knew you would give that as an example.
Because there are those who would like to test themselves,
Yes.
and there are those who would like us to test them. So we always have riders. So we send our team of the laboratory personnel. We usually use motorbikes. So the laboratory personnel will come with the testing kits. They test you if you prefer us to test you, and within no minute we give you the results even from your place. Then we go back to our facility. For those who need the testing kits only, still it's the same process. We have the riders who deliver the testing kits, and then they will leave them to you, and then you test yourself.
Yes. So now we assume that process has been successful. How does someone get the results?
So for clients whereby maybe the test cannot be performed at your home, because as well as you know, there are tests we can perform in the field and there are those that we need to perform from the facility. So for those cases whereby tests are needed to be performed at the facility, when we send the lab personnel and they collect the sample, they bring back the samples to the facility, the tests are run, and then we always give you options. Option number one, if someone can access WhatsApp, we can always share those results via WhatsApp or email, and then that is followed by a call to explain what those results mean, because after sending the result, it doesn't mean that someone will understand the results. For those that can't access WhatsApp, we always give those results via phone call. However, there are some results that are really very sensitive, and we can't give them via phone call or via WhatsApp. If at all the results are not negative or are not good, we always find ways of reaching back to you, maybe with a counselor, such that we give you those results in a face-to-face session, such that we give you counseling.
Actually, that's where I wanted to go. That what if the results are disturbing, somewhat concerning? Do you just send them to WhatsApp?
We don't send concerning results. I think I went ahead of the question.
Yes. Yeah, because my worry would be Director George might be eagerly waiting for the results, and you send him very disturbing results, and you cause a sudden death for no reason.
For those disturbing results, we always don't give them via WhatsApp or via a phone call. We always find a ways of reaching up to you, and maybe we have a simple counseling session with you as we deliver the results.
Yes, sir. You have talked about how someone can call, send an email, check your website, among other things, to access these services. But you haven't talked about anything to do with payments. So if I'm accessing those services, how do I do the payments?
The payments, we always give very many options to our clients. If at all A service has been it has involved someone coming physically to you, you can pay using cash. However, for the services that don't involve contact, we always use Momo Pay, Airtel Pay, so someone can use those mobile technologies that are available to transact. And actually, majority of our clients use that.
My follow-up question would be, how comfortable are patients or hospital clients with mobile payments? Remember, do they pay before or after? For example, if I'm ordering for 4 tests, do I first pay before the tests are done, or I pay after the results are out?
For convenience of our clients, usually we always pay on delivery.
So you do a digital payment on delivery.
Yes, sir.
So in essence, you are trying to say, if I'm looking for tests of 200,000 shillings, my doctor will incur the cost, have the results ready. What if I refuse to pay?
Of course, those are challenges that are everywhere in business. However, we always have that belief that from the moment someone has really entrusted us, we also give the trust back. So we say always our payment is on delivery.
In your opinion, where do you see the future of telemedicine, using my doctor as an example?
I believe the future of telemedicine is bright because, first of all, we are in an era whereby technology is fast advancing. We are in an era whereby majority of the people are continuing to access smartphones. We are in an era whereby internet spread in the entire country, at least it's growing. Of course, there are still some big challenges. However, we believe that it is growing over time. And these are some of the things that we really need for telemedicine to grow. Then, secondly, we've tried to preach the gospel of telemedicine as my doctor because currently you can't serve the entire country. Let me give you an example. We are located in Nansana. A patient calls in from Gulu because actually we have them who call in from wherever the country. There are those patients who will need to take maybe some lab tests or some checkups before we are to give them prescriptions. So there is something that we are realizing. We always refer them to some facilities that are near to them to run the tests. And from our feedback, there are very many healthcare service providers that are now coming to understand that, oh, we can receive clients through this and then it works. Actually, we've been having a number of interactions whereby we can have people that we can partner with in the different districts as we also try to grow our brand. And the feedback is positive, and these are getting clients through telemedicine.
Now, I wanted to ask you earlier, but let me ask you now. So I place a call. I have a problem in my abdomen. I'm located, let me say, I'm located in Masaka. How do you do the checkup when you are in your office?
It depends on what the technology that you can access as a patient.
I'm talking about a physical examination because I know you doctors always like physical examinations. So I'm in Masaka. I have pain in my abdomen. You want to see whether my organs are in the right places. How do you do the physical examination?
Maybe what I didn't explain to you. You see, healthcare or medicine is versatile. There are conditions that I will handle you 100% without you coming. However, there are some conditions that I will handle you at the part of consultation and they will need a physical checkup. We can't finish each and everything via phone call or via WhatsApp. So for such clients, after a series of consultation and we realize this person will need a physical examination from a doctor, we'd always advise them to visit a nearby health center whereby they can do the physical checkup and then they can share with us the feedback, the report afterwards.
All right. So I heard you mention that the telemedicine service is for free.
Teleconsultation is for free.
How do you benefit from a free teleconsulting service?
When we are looking at My Doctor, some of our goals are not to make money. we are looking at how fast can we improve the health of people from wherever they are amidst the geographical barriers that could be there. We will look at the monetary value maybe at a later stage, but at the moment, can we first help people who are growing? In the long run, it is also helping me as a doctor. If maybe you try to read about what they write about medicine right now, we are having a lot of cases whereby you have antibiotic resistance or medicine resistance. Do you know why that is coming about? It's because most people can't access doctors easily, so they end up running to drug shops or pharmacies to buy drugs without a formal prescription.
So they forego the consultation fee.
So they forego. It's not usually actually the fee; it's the process that they feel maybe it is a bit long.
It is the fee. Yeah, that's why you see I'm more interested in how my doctor can survive with a free teleconsultancy service, because I know most Ugandans, and I'm among those Ugandans, usually do the self-medication because of the consultation fee. For instance, if you have a kid that is sick and you have 100,000 shillings, they will tell you consultation is 50,000 before you do any test. Now, the chances are high that by the time you reach the point of buying medicine, you don't have any coin, because after consultation, the next thing is tests, right? So now what happens is a parent will say, let me go to the nearby drug shop or pharmacy and I explain my kid's condition to the healthcare provider there, and they recommend an antibiotic, an antifungal to use, and we use the 100,000 to get that antifungal or antibiotic, and even remain with some money for buying juice for the kid at home. So in all those so many words, what I'm saying is the reason why people skip the healthcare service providers and go direct to drug shops is because of the consultation fee.
I would believe your narrative. However, my submission still says it's not only consultation fee.
But mainly
However,
the consultation
it could
fee.
be also part of the reasons. But us as my doctor, we are saying consultation is free. How will we benefit? One, our aim first of all is to remove the geographical barriers for clients to get to reach to doctors as fast as they can or in a simpler way from the convenience of their homes. Then secondly, this patient that has consulted sometimes might not just stop at the consultation. We might benefit from the mobile laboratory services, and we can also benefit from the mobile pharmacy services. Since we've worked on this patient and is appreciating our services, this patient is going to is going to select us or have us as his or her healthcare service provider. We will recommend other people who will look for my doctor, and in the end, to help us in what we call brand awareness to a number of people.
In essence, the people that get the free telemedicine services, teleconsultancy services, become your goodwill ambassadors.
They become our goodwill ambassadors without us even giving them a single coin, maybe to advertise for us.
Yes, and now for the past 2 years, I know you have been doing this for 2 years. Like how many patients have you handled through the telemedicine platform? I want to hear those that have come physically, but I want to see the traffic of those that have opted for the telemedicine service.
In the year 2023, we had the total number of 4,632 clients that reached to us using what we call the telemedicine approach. So far, this year, I have statistics from January up to June, because we have entered another half of the year, and we've not yet, of course, tallied the statistics. So as of just these 6 months, we have so far reached 4,252. So we are almost surpassing the number that was for 2023. So which is a good sign for us, and it's a sign that at least we are growing and our services being appreciated by the community that we serve.
That's quite a number. What percentage of these patients are women?
I would say, I don't have the figures of head, but the biggest percentage of people who consult us through telemedicine are women.
Thank you, Dr. David. As we wind up this podcast, is there anything you think you wanted to say that you haven't said?
As my doctor, we are so glad, first of all, to 40 Days 40 Vintage for the platform that you people are giving us. And I would like also maybe to give this like a testimony. The figures that you're seeing that we had last year came after an interview that we had with you. It also helped us to connect us to some other brands that are into financial technology. Some even wanted to partner with us, and maybe we are still looking at the options. But the big numbers came after the interviews we had and were shared on your social media platforms. So I would like to encourage people that are maybe listening and watching to really embrace telemedicine, and also to approach us as my doctor for best healthcare services. Telemedicine has a number of advantages compared to the traditional healthcare because it saves you a lot of time. You don't need to have money for you to access the services because we give the options of mobile payment for the clients. Telemedicine also ensures that you are worked on from the convenience of your office or maybe your home, whereby you will have access to quality and professional doctors.
Thank you, Dr. David Mwesigwa and the entire team from My Doctor for the noble job you are doing for the people of Uganda. I believe you are receiving as much appreciation as possible because, like we all know, healthcare is expensive, but for you to provide it the way you're providing it, to say the least, is very noble. This has been day 9 of 40 Days for Fintechs, Season 5. Thank you for watching. See you soon.